Hello, good morning. Dr. Brad Shepard here, Simply Chiropractic. I hope everyone is doing well. I did not post last week because it was 4th of July, so I hope everyone had a good, safe 4th of July. Hope everyone still has all of their fingers and toes. And today we're going to talk a little bit about some of the underlying causes of low back pain. Now, um, we're talking more about the chronic low back pain, and speaking particularly into mothers. Mothers have it tough. You know, they have a lot of responsibilities on their plate, and it's very important for me to reach out to mothers to help them, and they're also raising the children, and if we teach mothers good things that they can incorporate into their lives, they can teach their children, and so we have a much better impact when we're talking to mothers than if we're just talking to just whoever. So mothers, this is for you, especially if you have the chronic back pain. This is back pain that's been going on for more than 3 weeks. That's kind of what chronic means. It means it's been longer than 3 weeks. So if you've had back pain for longer than 3 weeks, there may be something going on that you might need help with. And we're going to talk about some of those possibilities. One of the big things that I like to look at are, ergonomics. How are you, doing things throughout your day? What's your workstation like? How are you lifting? How are you, picking up your kids when you're bending over? Are you using your knees? Are you squatting, or are you just bending from the hips? That sort of thing. So those are some things that we want to think about. But here's something that not everybody thinks about. Okay, there are some underlying systemic problems that can be causing or amplifying that back pain. For example, an estrogen deficiency. Estrogen deficiencies can increase your risk for degenerative disc disease, or it can exacerbate or make that degenerative disc disease worse. And that's not something that we always think about, but there are studies out there, and I can cite those sources. There are studies out there that show that the estrogen deficiency can exacerbate disc degeneration. Who would have thought about that? That's something that's not really talked about in the medical community. There are other things like thyroid problems that can certainly amplify pain. It can also amplify and make arthritis worse, and not just the osteoarthritis, which is the wear and tear arthritis, but also rheumatoid arthritis. There's a link between thyroid and rheumatoid arthritis. So if you have if you think you might have some of these types of arthritis and you haven't had your thyroid checked, then call us, let us know. We can help you with that. We can check the thyroid. Now, my thyroid checks are a lot more thorough than most doctors are. And I don't know why. Probably because these tests aren't covered by insurance, and so the doctors don't order them. But I order them because I think that information is much more valuable than what you might save on your insurance. But also, I work with a discount lab, so I can get really, really good prices, probably even better than what your insurance can get. And I actually have I've worked with someone that actually worked at the lab, and we got a better rate than her employee discount. So I can really get those labs for inexpensive. We get lots of good information. Once we have those labs, we can create a plan, an action plan, to actually help mitigate some of these hormone imbalances. A lot of times these hormone imbalances are caused from nutritional imbalances. So there's really it's not a huge fix. It's relatively easy. It may take some time, granted. It may take a few months before we start feeling any different. But as we go through the program, we want to monitor the lab work as we go, so that we can make sure that we're seeing those changes, so that we're staying on the right track. Or if we get started on the wrong foot, we can take a step back and get started on the right foot. So it's very important to test these things. And when I do my testing in my office, I run a full panel of what your doctor would normally run, your primary care doctor, your medical doctor. and I add on a bunch of the hormones and things like that. I run 22 different markers. I actually have a hormone panel. I have an inflammation panel. Sometimes your pain is just caused by inflammation, and we can check that. That's a really inexpensive test. It's under $100, so we can check for the inflammation, or we can do a combined test to check for hormones and inflammation. It's a really nice, it's a really nice test, and we can get a lot of information. We can try to find the underlying cause of the problems. Now, if that's something that we want to incorporate with chiropractic, we can certainly do that, or we can do one separate from the other. And they both work. They both work better when they're done together, of course. Just like when chiropractic and physical therapy is done better together, chiropractic and massage therapy is done better together. Chiropractic, massage therapy, and physical therapy is even better when we do all three. And sometimes we need a little bit of help from your medical doctor to get you through a rough patch with some anti-inflammatory medications or something like that. So if we work together as a whole with multiple different providers, we're going to see much better results, especially when it comes to this chronic back pain that we've been talking about. And so when I want to help someone, I want to get as many healthcare providers involved as I can, so that we can really find the underlying cause of your issues, and so that we can really take care of you. And that's one of my goals at Simply Chiropractic, is to make sure that we're helping people get to the underlying cause of the problem, involving other healthcare providers to get the best results and to get the best long-term outcomes. So I hope this was helpful. If you have any questions or concerns, please reach out to us, 575-915-1550. You can also reach us on the web, www.simplychiropracticlc.com. And I hope to hear from you soon. And you have just a wonderful day. Bye-bye.